Hey, this is Dr. Findlay with Elite Chiropractic. Today I wanted to cover a topic about whiplash injury. So, I want to start with a question first. Have you ever sprained an ankle? So I think most people have rolled an ankle, sprained an ankle to some degree. And so you understand that, when you sprain an ankle, you roll it, that quick motion then it tears some of the muscles, some of the ligaments in your ankle, and afterwards there's a lot of instability with an ankle sprain. You can step on even the smallest pebble and re-roll your ankle after an ankle sprain just because those ligaments aren't as stable as they were pre-ankle sprain. So when we talk about whiplash injuries, that same concept of an ankle sprain essentially applies to specifically the ligaments of the spine and the neck. So here we have a diagram of a majority of the ligaments that are found in your neck, and I wanted to cover those a little bit. So obviously when you're involved in a whiplash injury, so that can happen in sports. The most common way we see it happen now is in car accidents. You get two cars hitting one another, and that force then whips the head back and forth, and you tear a lot of these ligaments. So I have a wheel vertebra here for my example. So imagine a bunch of these stacked on top of each other, all the ligaments in your spine. So you have a big one that covers the front side of all your vertebrae. Imagine that just running straight down the spine. You then have more ligaments that are in this canal here. You have a ligament that runs on the back side, the ligament that runs on the other side. You then have ligaments that attach, again, from this, what's called the transverse process, to the one below. And then you have more ligaments that attach to the spinous process to the one below. So, that's just a few of the ligaments. But again, when you are in a car accident or in a whiplash injury, you are tearing these ligaments. And so think of that instability that's in an ankle. Well, that same instability then can be in your neck after a whiplash injury. So the best thing to do after, again, any type of whiplash injury, whether it's a slip and a fall from sports or, again, car accidents, best thing to do is get checked out. Make sure that thing heals properly so that it doesn't cause issues down the road. We see a lot of untreated whiplash injuries cause chronic conditions later on down the road. So again, we got a lot of great tools here to deal with, healing these ligaments, making sure the neck and the spine are stabilized and that you can then be yourself moving forward.